Hi and welcome to Family Unbox. This is Lucy. Today I'm going to be talking on a very interesting topic, and I have an amazing guest who is going to talk on this interesting topic. The health and well being of everyone and every member of the family is very crucial, and we cannot put aside the well being of our kids, the teenagers in our lives. So today I have a doctor in the house. He is going to be talking on adolescent reproductive health. He's an amazing practitioner, someone I know you and I will learn a lot from him. And I believe that at the end of this recording, we will be glad we met with Dr. Adekunle. Hi, Dr. Adekunle. It's nice meeting with you.
Hello, good day. Thank you for having me on your program.
Oh God, I'm so grateful. I know you're very busy, but you had to make out time because you love
Yeah,
humanity. You love what you're doing. You love the teenagers, and I'm so grateful. Thank you very much.
you're welcome.
Very quickly, tell us about Dr. Kunle. Who are you? What do you do? I just want to crack a joke. Are you a vet doctor? What do you do? Of course, vet doctor is good. I mean, there's nothing bad about it. But yes,
Yeah.
tell us, talk to us about what you do and
Okay, so my name
how
is Adekunle Abiono.
yeah.
Medical doctor based in Nigeria. I'm a
Hmm.
general practitioner, but I have
Mhm.
interest in family medicine. I have interest in adolescent health and sexual and reproductive health. I also have some interest in maternal and child health. Yeah, so
Wow,
that's
this is
like a brief
amazing.
about me.
This is
Yeah.
amazing. I remember I had a stint in maternal health regarding mosquito and how it affects maternal and childbirth and all that. I did a
Yeah.
little bit of that way back in my
Right.
sojourn in my sojourn in public health. So it's
Great,
interesting
great,
that
great, great.
we're having this conversation now. Dr. Kunle, what is
Yes.
adolescent reproductive health?
Well, adolescent reproductive health can be defined as can be aimed at having a youth learning about their body, learning about reproduction at that age, and also learning how not to get into trouble,
Hmm.
learning how to keep a high level of hygiene,
Hmm.
because some youths want to abstain while
Yeah.
some want to explore. You want to teach
True.
them how to explore safely and not get into
Oh.
trouble. Yeah, you
Oh.
want to teach those who don't want to explore, you want to teach them how to stay
Abstinence.
sane and abstain. Yeah.
Hmm.
Also, adolescent health also entails taking care of your body,
Hmm.
letting a lady know what the period is like.
Hmm.
Letting a man also know that at some point in his life, when he gets to some certain age, he will grow some secondary sexual characteristics.
Yeah.
So
Yeah.
that's all. That's part of what all adolescent health is about. Yeah.
Whoa. This is interesting. Now, you said something that for those who want to explore, how to explore
Mm.
safely, and I do understand, like I said, I was in this, but as a parent, I mean, most parents will not want to think about the fact that their children should explore. Don't tell me
Yeah.
about it. And I know that when you want to explore, one of the things that we tell them to do is to use condoms. Now,
Yeah.
why should a parent allow or think about the need to allow their children explore? Because you don't allow them, they will explore anyway. What are the
Yeah.
pros and the cons of it? Yeah.
You just made a point there. If you hold a teenager back from exploring, the teenager will explore behind you and probably get wrong, get
Yeah.
his or her finger burnt.
Yeah.
The highest number of HIV positive patients
Hmm.
currently in Nigeria in teenage. The highest level of
Really?
tuberculosis cases currently in Nigeria are in the teenage. So it's just about the devil and the deep blue sea. If you don't allow
Wow.
them explore, they will go ahead and explore anyway. So as a parent, you have to be able to keep an open mind to
Hmm.
allow your sibling, your children have their own idea of what they want to be, and then they can be open to you, and then you can guide them after they are being open to you. That's the key. You bring them in, make them know you understand them, make them know you love them, and then they can be open to you. When they are open to you, that is the only way you can be able to guide them.
At what point do you think that when is it too much? Because again, we've seen situation where it's like this teenagers are without control. It's like youth without borders. Parents are almost
Mm.
not guiding them because they want to allow them explore. At what point is it too much? At what point how do we put a regulation? What should be the boundary? Because I'm a parent, and I mean you are in this, it's tough. Like I
Yeah.
ordinarily, averagely, if I open the bag of my children and I see condom, like my head will explode. I'm like, even though I know they do this thing, I don't want to be. I just don't want to think about it. And then there are this other part where parents just allow their children, they go haywire and they do different things. At what point? How do we draw the line?
First thing first, charity, they say, begins at home.
Yeah.
First, be a friend to your child. Be a friend first, then that is
Wow.
the only way you can be a confidant.
Hmm.
If you are not a friend, you can't be a confidant. And
Hmm.
children ordinarily, adolescents ordinarily, by the time you get into puberty, the hormones of your body makes you want to be with the opposite sex. It's a natural
Yeah.
thing.
Yeah, it
So
is.
it's something even they do not have control over. So the moment they
Hmm.
start feeling that way and they see their parents as a friend, then they talk to you as a parent, then you're able to guide them. This is the whole essence of adolescent reproductive health guidance.
Hmm.
Guiding these people not to fall into unwanted pregnancy, guiding these
Hmm.
people not to get into unsafe abortions, guiding these
Hmm.
people not to get sexually transmitted infections,
Hmm.
even personal hygiene, guiding them all the way. That is the whole aim of adolescent reproductive health. Drawing the line now will now also lie on the level of communication you
Hmm.
have.
Hmm.
You allow your children, your teenager talk to you in their own language. Sometimes you need to learn their own language. Yeah. So that you can feel like you are the same thing, so that they can feel like they can talk to you, you know.
Hmm.
So that's really the only way I can put out there to say, okay, you can be on the same page somehow with your kids when it comes to that. Yeah.
What is government? What is the commitment of government? And we're not talking as in regard to one country, we're talking of globally. What is best practice? What is societal best practice? What is government putting in or should put in? I mean, you are in this, so you know both country wise, and you know best practice across the globe. What is
So
the involvement of government in all of this? Yeah.
there are some days that we celebrate International Adolescent Days,
Hmm.
and I believe most countries have some programs put in place to
Hmm.
help youth understand themselves, both sexually and also intellectually. What the government should do is to create an avenue for education, maybe into the curriculum from children getting into the first year of high school,
Hmm.
to
Hmm.
know
Yeah.
how conscious you should be of your own body, the
Hmm.
dangers you are prone to if you don't take care of your body. You know, I think government should also put in some curriculum based teaching
Hmm.
on that. It can also be like a free testing day for STIs, free
Good.
testing.
Hmm.
There could also be some areas of accessibility to contraceptives. Maybe
Yeah.
create an online platform. Let contraceptives be available online.
Hmm.
Some schools put condoms here and there, just so it's accessible, just to sensitize
The
adolescents
children, yeah.
onto what they are about to do or what they are doing. Because we know you do it. Let's know you're doing it safely. You know.
Yeah.
some schools also can government can work in partnership with some private clinics in offering any sexual reproductive assistance, be you counseling, be you um, counseling, contraceptive
Education.
services, education.
Yeah.
Yeah, so I think those are some of the things that the government can put together, and make things happen. Yeah.
Okay, again, I want to come into the place of STIs. STIs has ravaged a lot of people, and some people don't even know they carry these things. What are those common STIs, and how can young people be aware that they probably have the symptoms and they probably don't know, and how can they mitigate STI? I know condom is one of the ways, abstinence could be another, but generally, how will they know that they have these symptoms, because most of them don't even know they have it.
Yeah. So sexually transmitted infections generally are infections that are transferred from male to female. Could be male to male, could be female to female, but they're always sexually oriented.
Yeah.
So, for the commonest ones, we have syphilis, we have gonorrhea. Those are
Yeah.
the very common ones.
Yeah.
Um, both of which, if poorly treated, can lead to some level of infertility in the future.
Yeah.
The commonest symptoms of syphilis is when there is a painless wound. There will be a wound in the genital area, but it's going to be painless. You get, yeah. So most times it's overlooked until it spreads, and then until you start spreading it. If the person has more than one unprotected sexual partner. For
Wow.
gonorrhea, there's usually gonorrhea in females is usually silent. Most women do not come out with the gonorrhea.
Wow.
Also, chlamydia, although chlamydia is okay, I'll come back to chlamydia. Let's say gonorrhea now. So in
Yeah.
men, there's a penile discharge which can have an odor, which
Yeah.
can be plenty. The discharge could be plenty, sometimes scanty,
Yeah. Yeah.
and then it deserves immediate medical attention. Immediate
Attention.
medical attention. There's usually a history of having a sexual partner who you're not sure of his or her or probably her hygiene or where she's
Yeah.
been.
Yeah.
For chlamydia, for females, there's this foul, smelly discharge too. Sometimes they have painful urination, and sometimes they could have low abdominal pain too. You get. Also, there's a viral. These are bacterial. These are bacterial in nature. So the viral one, the most common viral STI is herpes. And I must say, back here, herpes is one of the fastest spreading viral STI that I've seen so far.
So when you say back here, you mean Nigeria or Africa?
Back here in Nigeria, I mean, because herpes can get herpes through oral sex. You can get herpes through penetrative sex. Yeah, because when you have oral sex with a man or a woman who's got herpes, within 48 hours, the person starts developing blisters on the mouth, on the
Ooh.
lips, maybe sometimes
Ooh.
on the lower lip, then spreads to the upper lip, and then have a very ugly picture there.
Is it
You know,
treatable?
well, yeah, it is. Most times it runs its course, even while on treatment, it still runs its course. The drug we use for it just aims to like reduces the virility of the
Yeah.
organism. Yeah, so the drug just brings the power down. Then um, the, it runs its course. Then for genital herpes, that's caused by the popular herpes simplex virus or human papilloma virus. That is quite dangerous. That has no
Yeah.
cure. It has no cure. But 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 if it's picked early, You can use the same drug to reduce the potency. Unfortunately, the highest, the number one leading cause of cervical cancer in this part of the world
Oh,
is
HPV.
H human papillomavirus. Yeah, the virus that causes herpes in vagina.
Wow.
Yeah, human papillomavirus that causes um, viral herpes. Yeah. So
what's it called, vaccines? Are there
yeah,
vaccines that people
so
can take, and
I was
how
coming
much
there.
is it? Okay, great. How much is it
Yeah,
available in Africa and across the
yeah.
globe? Mm,
So for the hepatitis, for the human papilloma virus, the
mm-hmm.
vaccine is quite common now.
Oh,
Before it wasn't so common before, but now it's quite common. So
okay.
we advocate it for children, for ladies from 9 years old.
9.
That's quite that's quite interesting. Yes, so ladies females from 9 years old are eligible to get vaccinated against HPV, which is the leading cause of cervical cancer in this part of the world.
Are you trying to say that 9-year-olds are commonly sexually active already?
Well, so before they become sexually active,
Okay,
because
okay,
the protocol for administration of the vaccine is the lady must first get tested
okay,
and be negative
okay,
before she's eligible for the vaccine.
okay.
So if ordinarily you can pick up a 9-year-old girl who is not yet sexually exposed, she doesn't need to be screened. She just gets the
Yeah.
shots. 3 doses, she's good for life against cervical cancer. So there's an ongoing awareness now, and we are working with some private facilities to make sure we get as much as possible people get immunized against hepatitis, human papillomavirus. Yeah. So that's also one part of the positive one positive part. We are
Yeah,
mitigating the future danger of our youths
yeah.
by vaccinating them. Yeah,
Wow. Wow.
yeah.
Okay, now, I know when it comes to hygiene, people just think, okay, you're a female, you're an adolescent, you clean up, you shave your armpits and all that. But there's more to hygiene, especially when it comes to menstrual flow. Excuse me. How should parents, how should the government help teenagers, adolescents, keep them clean? I mean, like out here, I think you can actually go and access free pads and all that. Parents, some families cannot afford these things. I know way back they used to give people cloth. You can use cloth, ladies can use cloth to do their menstrual flow, which is not a
Mhm.
cleanest way.
It's
But
not
in your
hygiene
own
at all.
experience, what will be your advice?
So we have, unfortunately, in this part of the world, we have a government that is not so inclined in that aspect. So we have a couple of NGOs. Sorry, we have
Thank you.
a couple of NGOs that spring up. There's some people on Instagram that run campaigns for free pads for ladies in low income areas. They
Yeah,
go to their schools, they give them pads. It's also very important to teach a girl child what form of hygiene she needs to maintain at that time of her period when she starts her menstrual flow. It's important to note that
yeah,
when a female starts her period, at some point the period might stop coming
yeah, yeah,
and then restart again later. Most times there's a lot of panic from parents when they see that their child is not started her period 6 months ago. Now she's not starting her period again. They're panic. Is she pregnant? Someone touching you? Is somebody molesting you?
yeah,
Yeah, so it's common.
yeah.
So it's
Wow.
important to put that out that a child who has started a period can also stop the period then to
Thank
restart.
you.
But
Yeah,
it's important to teach that child how to take care of her body, how to wash properly. It's important to let that child know that now that you have started seeing your period, you have to shave towards your period so that you don't have clots of blood sticking around your vaginal region after you change your pad You have to
Yeah.
teach them how to carefully change the pad without smearing the toilet seat, without smearing the floor. These are little things, but they really count in making a girl child meticulous enough about her period. Also, you have to, because also when a girl child is on her period, her hormones are raging. Some of them
Yeah.
have this body odor that becomes stronger. You have to teach a girl child to know how to use a deodorant. Even male, even any
Yeah.
adolescent, anybody
Yeah.
in puberty will have that raging odor that
Hold
comes. You
on.
have to teach a girl child, and teach an adolescent how to take care of that odor that comes out for the body. And then the hormonal changes that come to the body during period, acne, some have breast fullness, some have menstrual cramps. So education and communication goes a long way. I mean, that's about all we're teaching here: education and communication to our adolescents about how to do this and how not to do this, what to do and what not to do. Yeah.
Again, I want to quickly ask you, when is the right time to begin to have sexual education with our children? When is the right time? Is there an appropriate time? And if there is, when is best practice time for any parent to
So
begin to have sexual education talk? Yeah.
once a child is able to identify her body parts, then you should teach the child what that body part means and how precious that body part is. Because we've seen a lot of cases of child molestation
Yeah.
where the child doesn't even know what the molester is doing to him or her, until there's a problem. Then the parents will say, "Oh, if I had known, I would have taught this child." I believe once a child knows how to name and label his or her body parts, it should be taught that these parts of the body are not to be played with by any other person, and not even by you. They're not meant for play. Yeah. Then it's also important that as they grow older, more conversations are held. I still believe in including sexual education into the curriculum of schools from here we call it GSS 1.
Yeah.
But sometimes if you have older students in your primary 5 or primary 6, you should start engaging them with sexual educational lectures, because it goes a long way, really. It goes a long way.
I agree,
And then,
absolutely.
then it has to be a continuous thing, because
Wow.
the human body is dynamic. You might experience this month, next month you're experiencing something else. So you know who to ask the right questions and what to ask. It has to be a continuous educational process. Yeah.
Now, you read medicine, so it comes to you naturally. I didn't, and maybe my experience does not expose me to the ability to begin to have this kind of conversations. I'm not a
Yeah.
psychologist. Okay, in my field of training, I am privileged to have this kind of understanding, but there are tons and tons and tons of parents, male and female inclusive, who do not have this understanding. What is the government? What is the system? What can government system do? Communities, non-for-profits, organizations, what can they do to empower parents? Because honestly, it could come easy for you to call your children and speak with them.
Mm,
It could
mm,
come kind of easy for me. And again, there are certain age these children get to, you want to talk to them, they shield you, they don't want to hear from you.
mhm,
How and
mhm.
what can we do to empower? This is one of those things though, so parents know that they have to have this conversation. But how do they start? Who do they run to? How do we educate parents on what to say and how to start the conversation?
So in this world of social media, all these kids have phones. All these kids have people who influence them online. I think it's important to identify who influences your kid. That's the first thing. Yeah. Once you're able to know who influences your kid, then you can know what kind of manner or approach you can use to talk to your kid. This education should come from every angle. The government should set it up in schools, Online influencers should make noise about it. NGOs should set up awareness for it and make sure voices are heard. Parents should watch out for who their kid listens to. Then from that angle, you can come in because you can't have a kid listening to a comedian and then you are coming from the angle of a preacher. It won't work. The child
Yeah.
automatically sees you as don't come
Who
near
are
me, you're
you?
preaching.
What are you
Yeah,
saying?
exactly.
Yeah.
So if you understand that your kid loves comedy and you come in from the role of comedy, the kids naturally is drawn towards you.
Mm, mm,
And then
mm.
you start having those conversations. You start from the basics. You can't just have a 13-year-old because she sees she's mature and let's say, do you have a boyfriend? She's gonna run away. Yeah.
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 Like,
So you
Daddy,
have to
what are you
start
saying?
yeah, you have to start from the basics. How are you? How is school? Then your period, do you know how to calculate? Do you know how to time it? How do you feel on on those times? Just make them a bit more inclusive. Be concerned about their in and their outs. Then
Yeah.
that way they're naturally just drawn to you that way. Just drawn to your
I'm
period.
I'm I'm going to ask you just two questions and then we'll wrap it up. I'm going to ask you
Okay.
two questions and we'll wrap it up. Again, I just want to say a very big thank you. The first question is this: I heard so much while I was in the community in Africa doing my thing. I heard a lot of people tell you their daughter is pregnant and never saw her menstrual flow. My
Mm.
explanation is this: she has been sexually active. And they were like, oh no, the village, the rural kind of environment, how did it happen? She is pregnant, but they know she's never seen her period. And I'm like, she has been sexually active, ovulation took place, and then before the egg,
You're pregnant.
whatever medically you guys will explain it, something came in
Mm-hmm.
and in contact. And they were different disbelief. Different people said, oh, the pads you guys are sharing, because I was in the community doing condom sharing, pad
Mm-hmm.
sharing, a lot of things.
Mm-hmm.
They said it was imbibed with a lot of other things. My common explanation was this child is already sexually active. Help me
Yeah.
out.
So in my experience with community medicine, because I did a lot of rural and community medicine during my NYSC and my years
Okay.
immediate post NYSC, I saw a child of 13 years get pregnant. I saw a child of 12 years. I've seen a 12-year-old get pregnant. So that 12-year-old never saw a period.
Wow.
But immediately she started getting the secondary sexual characteristics, the the breast, the hips. She started rolling with some other type of girls who are started seeing their period. And then boom, her first sexual experience, she gets pregnant. Yeah. So I've seen that before. She was 12 years old, and I've seen several amount of ladies who get pregnant just after seeing one period.
Yeah.
There's this community in South Nigeria where I was opportune to work, where they said if a lady sees her period the first time, then they will tell her to go and test herself to see whether she can get pregnant. Oh yeah. Then after their first period, they start getting seriously sexually active, and then they will usually most likely get pregnant. Yeah. So if you try the first month, you don't get pregnant, you start getting worried. You see your period
Oh
again,
my
you don't get pregnant.
goodness.
Yeah. So after 3, 4 periods or 5 periods, you still don't get pregnant. They term you as an outcast. And maybe,
Oh my
maybe,
goodness.
maybe, maybe you can't get pregnant. Yeah, I've seen it. I've
Yeah,
lived
so
in that.
that means you're not even a wife material.
Thank you. Thank you. You
Oh
get it.
my goodness. Oh my, and the government is unaware of this. How much
Very, very,
education are we bringing?
very, very unaware, unfortunately.
Oh my goodness. There's a whole lot
Mm-hmm.
of mess out there. And
Yes,
then
there
we
is.
blame people who are baby mamas. Some of them don't even know who the father of the baby is because they try different people.
I Let me just chip it in. I saw a woman back then. It's about 12, 13 years ago, and she has 5 children.
Oh
And
my
then she
goodness.
came to the clinic with five of them. They all had a similar viral cough and catarrh.
Oh my
So
goodness.
I asked for their names, and they all had different surnames. And I'm like, okay. She now told me that these two, she had them for one man. That the man is in so and so town. I said, where is it? Do you know? Do you see? They say no. She doesn't even see the man again. She doesn't even know how the man is. But when she had them, they were not like they were married, and then she just had two for that one for another one for another one. I mean, so she just had just like that. That's how crazy it is in some of these local communities down here. Yeah.
I need you to speak as we close up this conversation. Honestly, my heart is heavy. I didn't know this kind of realities are still there. I have an idea,
Yeah.
but honestly, I thought we've grown past all of this. I need you
No,
to
we haven't.
speak.
No, we haven't.
I, I,
Unfortunately.
I need you to speak to governments, to culture. Just speak to people, speak to parents, speak to families, speak to teenagers. Just speak to people, please.
Well, in as much as our hormones drive us, we should have a high level of control over our activities, and we should be able to own up a level of responsibility towards our actions. As parents, you owe the community, you owe the society, you owe yourself and your children some level of clarity and friendship. You owe them some level of closeness, and you shouldn't fail them in that aspect. As government, you owe the citizenry a whole lot of awareness and easy accessibility, enough funding for sexual and reproductive health matters.
Yes.
As NGOs, I know a lot of NGOs who are doing a lot.
Yeah.
We can still do more in sensitizing other NGOs, in bringing in much more education and communication in this space of adolescent health. Because the youth, they say, are the leaders of tomorrow. If we don't build today, if we don't build the youth of today, we will definitely have no leaders for tomorrow.
Yeah,
That's my
right.
last word. Thank you.
Wow. Honestly, I just want to say a very, very, very huge thank you. Like, I started this conversation pretty just to inform and to in a very light mode, but I'm ending it. My heart is heavy
Yeah.
because this is so unfair. Why don't they do the same to the men? Why don't they make the men go and I don't know, like it's
Well,
it's
well.
unfair and it just breeds a generation of people who are unclear. They don't even know what they want of themselves.
Hmm.
And I know you're
Hmm.
doing a whole lot of people are doing a whole lot, and that is why Family Unbox is here to create awareness, to create education. Hopefully some people will come to the truth and they begin to do what
Yeah.
is necessary. Thank you so
Yeah.
much, Dr. Kunle.
Thank
i
you. Thank you
I
very
can
much.
only say thank you very much. I hope when I call you again you will be here for me.
I will. I will. No
All
problem.
right. Thank you. Do have
All
a
right.
great
Take care.
day. Yeah. Bye. Yeah. Oh my goodness. There's a whole lot going out there that you and I are unaware about. Like it beats my mind to think that there's a community where immediately a girl begins to see her menstrual flow, you ask her to go and be sexually active just to test if she can be pregnant. And so what? When she's pregnant, what happens? She becomes a wife of who? Is she a commodity? Like all of this is overwhelming. It blows my mind. But what can we do? Is the reality before us. And as parents, as society, as government, we have a responsibility and a huge one indeed to ensure that we create awareness, we teach our children, we put systems in place. These are things that are very heavy and very very deep in my heart. I've advocated severally in time past, and I'm still here. I want to do this again and again. We need to educate our children. We need to empower adolescents. We need to support them. And adults, please stop abusing the children. Give them the resources that they need to become who they need to be. This is a place where we try to create value. And this is Family Unboxed with Lucy. Honestly, it's a privilege every time to come with discussions to you, and I feel very excited and very enthused. Thank you for tuning in. I want to plead with you to subscribe, share this video, Like, drop me a comment, whatever it is you want us to talk about, or whatever it is you want to share with me. Please drop a comment. I'll be more than glad to launch in and throw in ideas. And where my ideas are not sufficient, I have a group of people who are well experienced in every field regarding this situations and issue, and I'll to push the topic or the question to them. Whatever feedback they give me, I will bring it back to you. Together we can build a community that thrives, a community that works, a community that is able to be what it needs to be. Your children, my children, they deserve the right to a great life. Let's give it to them. I love you until I come your way again. Stay blessed. Peace.